Are you traveling internationally this summer with your family and wondering if you should schedule a pre-travel visit with your pediatrician? The answer is yes, and we're going to talk all about it on today's episode.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. My name is Dr. Blair Rolnick. For those of you who are new to the show, I'm a board-certified pediatrician and I'm a mom myself. So as summer is approaching, a few of my patients have reached out prior to their summer travel plans and asked if they should be scheduling an appointment with me before they go abroad. And the answer to that is yes. And today we're going to talk all about some of the conversations I have prior to international travel, and we're going to focus a little bit on some continental specific topics as well. So the practical first question I get from parents is, when should this appointment occur? And I tell parents, ideally you want to schedule this appointment with me 6 weeks prior to your travel plans or your departure date. And the reason for that is, depending on where you're going, there may be some very specific vaccination requirements, and certain vaccines can be hard to get a hold of or even might require a trip to a specialist like a travel medicine doctor to receive them. I also recommend that parents take a look at the CDC and the WHO websites prior to an appointment with me or prior to their travel plans. These websites can be really helpful in empowering parents with the knowledge about what diseases may be endemic to the area and what the requirements might be for entering the country itself from a vaccination standpoint, and what health considerations they might face while there. Really, my goal for these appointments with my families is harm reduction, meaning preventing vaccine preventable illnesses where possible, and discussing general health safety topics. So usually that starts with discussions around mosquito and tick-borne illnesses, food and water safety, and then general safety concerns. It also might include a discussion about airplane safety as well. So you all might have seen in the news recently, there was an airplane that had quite a bit of turbulence and some of the passengers were severely injured. And because of that, now the AAP is actually recommending that children under 40 pounds should be restrained in a car seat on an airplane due to turbulence. So that's one new recommendation I've been discussing with parents, as well as just general concerns about traveling with your children on a prolonged airplane ride. From a food and water standpoint, it really depends on the country that you're traveling to, but generally the safest thing is to drink bottled water and to make sure all the foods that you and your children are eating are fully cooked. And if you're going to be eating fresh fruits and vegetables, to either wash them or selectively choose fruits and vegetables that have a rind that can either be peeled or cut off so that you're eating the center of the fruit. Most illnesses while traveling abroad are foodborne illnesses, and that usually comes from underwashed or contaminated fruits and vegetables that have not been cooked or undercooked food. So the best way to avoid that, again, is eating fully cooked food, to wash your own fresh fruits and vegetables, or avoid the rind altogether and peel it off. And that kind of naturally leads into a discussion about traveler's diarrhea or diarrhea abroad. This is, again, probably after general safety concerns, the number one concern I have for children traveling abroad. The most common forms of foodborne illnesses while traveling is traveler's diarrhea, which is usually from E. coli, but also depending on where you're going, you may be at risk for Diarrhea as well as Salmonella typhi. And so it's always a really good idea, especially for those younger children who are at higher risk of dehydration. So those are going to be children under the age of 1, particularly less than 6 months old. It's a good idea to either travel with a pre-made oral rehydration solution or have a recipe for one with you when you travel. So everyone who, again, I make an appointment with at the office for a travel medicine visit, I usually give them a recipe to make the oral rehydration solution in whatever country they're going to, because I find it's a little bit easier than packing all those tabs with you. I also like to have a long discussion with parents about the signs of dehydration that would be concerning. So those are going to be making less wet diapers than usual, drinking a significant less amount than usual, a child who is sleepy or lethargic, they can't engage in their normal activities, especially for those little ones, looking at their urine output, not just the number of diapers they're making, but the quality of those diapers. So if they're feeling lighter than they usually do, then you want to initiate oral rehydration at that point. I will also generally give my patients a prescription for Zofran when they go abroad, because it has been shown to reduce the risk of a child with gastroenteritis winding up in the emergency room from dehydration. So if you want a full discussion about the evidence behind that, you can go to our episode on the stomach on acute gastroenteritis and vomiting in children. The next thing I will talk about with dehydration in parents, and specifically travels diarrhea, is I usually do recommend that they take a prescription with them for an antibiotic. If they have signs of fever, high fevers, blood in their stool, a lot of pain or cramping, or they're having so much diarrhea that they can't really leave the room, I will recommend at that point that they start a 3-day course of an antibiotic. And usually, again, I'll be giving that prescription with them to pick up the medication and take that with them abroad. The next discussion I will have with parents in a pre-travel visit is usually looking at and discussing their vaccinations. So any child traveling abroad should most definitely be up to date on their vaccines for their age, but there also may be specific vaccine considerations depending on where you're traveling to. And so I'm really focused on taking a look at their MMR status, their hepatitis A status, their DTaP, and their meningococcal vaccinations. So let's just start with the TAP. So MMR, measles, mumps, and rubella, is a vaccine series that starts at 12 months. The CDC and ASAP have updated their guidelines because measles is commonly brought back to the US from an unvaccinated or undervaccinated person traveling abroad. And there have been measles outbreaks all over Europe, that the recommendation is now any child traveling abroad should receive 1 dose of MMR prior to travel. That dose of MMR, importantly, part of the discussion is that dose of MMR does not then count towards their routine childhood immunizations. They will still require their 2-dose series starting at 1. So again, that's 1 dose of MMR for any child greater than 6 months traveling anywhere internationally abroad, and then starting their routine MMR vaccination series starting at 12 months. For more information about signs and symptoms of measles and the efficacy of the measles, mumps, rubella vaccination, we did a full episode on that recently because there was an outbreak locally, so I encourage you to check that out for more information. The next vaccine I usually talk about with parents before they're traveling abroad is the hepatitis A vaccine. So hepatitis A is usually a foodborne illness, and it is endemic to many countries, including the United States. We usually have an outbreak once every couple of years. Most recently, we had one in 2023 from organic strawberries. So it is a vaccine that is endemic to many countries, and so it's a common one to be brought up. Additionally, this is a vaccine that, depending on your age, you might not have received as your primary series. It is now recommended for all children between 12 and 24 months to start their hepatitis A vaccination series. It's a 2-dose vaccine. Again, the first one between 12 and 24 months. But some of those older children and adults might not have had this as part of their primary series, so they also might need the hepatitis A vaccine before they travel abroad. The ASAP and CDC do recommend any child between 6 and 11 months traveling to an area endemic with hepatitis A that they receive 1 hepatitis A shot prior to travel. And just a side note, many of these vaccines require weeks to reach their efficacy. And so again, that's another reason why you want to schedule this visit well ahead of your travel date, your departure date. So we have plenty of time to get those vaccines if we need them, give them, and have time for them to be effective, which kind of leads me really nicely into the typhoid vaccine. So depending again on where you're traveling, if you're traveling to an area that has typhoid fever endemically, you are going to want to get a typhoid vaccine for any of your children greater than 2 years old. And that takes several weeks to become effective. It's good for 2 years. But that's another vaccine you might be potentially considering when traveling abroad. DTaP, everybody at this point should be getting boosted with a pertussis-containing tetanus vaccine. So there should be no more DT, which is tetanus and diphtheria. They should either be TDAP, tetanus, diphtheria, and acellular pertussis, or DTaP, diphtheria, tetanus, and acellular pertussis. And the reason for that is you never know when you're going to step on a dirty nail or get a dirty wound or cut. And the last thing that you want on your vacation is to be running to the local clinic or ER to get your TDAP, your tetanus booster. So that's one, again, I recommend everybody make sure they're up to date prior to travel. And lastly, I want to talk a little bit about meningococcal and yellow fever. So meningococcemia or meningococcal vaccines should be considered for anybody traveling to the meningitis belt, which is really North Africa. And so that might be a vaccine we're considering. And then lastly, I want to talk about yellow fever. So some countries actually require proof of yellow fever vaccination. And so that is a vaccine that you need to have a special license to store and administer. So this is one where I'm sending my patients to a travel medicine doctor or clinic. So if you're traveling to a country where you know yellow fever vaccination status is required, or it's endemic, that is when I'm like, make the travel medicine appointment with me at 8 weeks so that we can get you ideally into travel medicine doctor no less than 4 weeks before your travel. Again, ideally more like 6 weeks before your departure date. So they have time to get the yellow fever vaccine, administer it to you, and make sure that it's in the time frame required for entry to that country. And the last thing I want to talk about for today's episode is actually transportation safety. So the number one risk actually to children traveling abroad is injury sustained during transportation. And there's many reasons for that. Some of it has to do with sometimes people driving in a country that they're not used to with rules and regulations they're not used to. Some of it has to do with vehicle safety. The standards in other countries can be quite different from the United States. And so I really encourage parents to think about transportation, especially ground transportation safety in another country, making sure that they have a car seat with them or a travel car seat if it is age appropriate for their child, making sure the vehicles that they are using for transport are safe and up to date. If they are not driving, to make sure that the person driving is someone who they have received information or feedback like from a travel agency or for the local hotel that is safe mode of transportation. And that kind of wraps up today's episode. On next week's episode, we are going to continue to talk about travel medicine and travel safety. We're going to focus a little bit more on mosquito and tick-borne illnesses and injury prevention from that standpoint. I hope you guys found this episode useful, and I hope you all are looking forward to wonderful and beautiful summer travel plans.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.